Welcome to the pre-operative patient education video for spine surgery for the Back and Spine program at Cabell Huntington Hospital. This video will serve as your required education prior to surgery. The video will take approximately 30 minutes to complete. After you have viewed the video in its entirety, call our office to complete the post-test and functional assessment. The post-test and functional assessment will take approximately 10 minutes to complete over the phone. I am Rhonda Neal, the clinical coordinator for the Back and Spine program at Cabell Huntington Hospital. My office hours are Monday through Friday, 7 a.m. to 3:30 p.m. My office phone number is 304-526-2613. I can also be reached by email at rhondanneal@chhi.org or via fax at 304-399-6541. I am available both before and after surgery as a resource if you have questions or issues. This video will cover information it is necessary for you to know before, during, and after surgery. You can pause the video at any point to take notes by pressing on the pause symbol, which usually appears in the lower left-hand area of the screen. Press the forward symbol to restart the video. Here is some information that will be helpful to consider as you begin to prepare for your spine surgery. Patients frequently ask, why do I have to take the class before surgery? The medical community has known for many years that the patients that do the best in the long run after surgery are the patients that are the best prepared prior to the surgery. In other words, well-prepared patients tend to have superior outcomes. They tend to have less pain and anxiety associated with their surgery, shorter hospital stays, fewer complications, and are better able to follow their surgeon's instructions. Length of stay in the hospital can vary depending on your procedure and your surgeon. Single-level cervical or neck surgery is usually overnight, 1 night. Single-level lumbar or back surgery is usually overnight, 1 night, or you may be discharged the same day as the surgery. Multiple-level neck or back surgery is usually 1 to 2 nights, and multiple-level neck or back fusions are usually 2 to 4 nights. SI joint fusions are usually overnight, 1 night. However, some are discharged the same day as surgery. A fusion is when we are trying to get 2 pieces of bone to grow together to produce stability of the spine. There are required steps to the preoperative process that must be completed within 30 days prior to surgery. Those steps include your medical clearance visit with Dr. Fetty, registration, and pre-admission testing. It is not necessary for you to see your primary care provider unless specifically instructed to do so by Dr. Fetty or your surgeon. The pre-anesthesia assessment is usually completed by phone and COVID screening if indicated. COVID screening is not currently required. Please keep in mind this could change depending on the status within our community. We will follow the CDC and local health department guidelines at the time of your surgery. We encourage our patients to actively participate in their care decisions regarding procedures, treatments, pain management options, and discharge options. You will be given several do's and don'ts during the surgical procedure process. It is important to follow the surgeon's recommendations and make good decisions regarding your health and wellness. Remember, you are responsible for the decisions that you make and for their outcomes. We strongly recommend that patients stop the use of any tobacco, smokeless tobacco, and nicotine-containing products 6 weeks prior to surgery. Some insurance companies require cessation of nicotine use prior to some procedures. Having nicotine in your system increases the likelihood of developing complications after surgery. For example, heart attack, stroke, blood clots, infection, poor healing, infusion failure, infusion procedures. With any surgical procedure, there are risks involved. All patients have some degree of risk, even though spine surgery complications are rare. The most common complications following spine surgery are pneumonia, infection, and blood clots. The majority of surgical complications are preventable. First, let's take a look at pneumonia. Pneumonia can be caused by anything that causes your breathing to be slow and shallow for an extended period of time. This allows the normal secretions or mucus to accumulate inside your lungs. These accumulated secretions and tissues of the lungs can become laden with bacteria. That is a pneumonia. Anesthesia, inactivity, and narcotic pain medication can cause your breathing to be slow and shallow. Aspiration of stomach contents can lead to pneumonia. Aspiration occurs when stomach contents end up in the lungs. This is more likely to occur in patients who fail to follow the restrictions on eating and drinking prior to surgery. Pre-existing lung conditions such as COPD or emphysema can increase the likelihood of pneumonia, as these patients tend to have more difficulty clearing respiratory secretions. Also, smoking increases the chance of developing pneumonia after surgery. In order to decrease the risk of developing pneumonia after surgery, there are some simple activities we recommend. Early activity or walking as soon as you're allowed after surgery, usually the same day. Nursing staff or physical therapy will assist you on your first trip out of bed after surgery. We encourage several frequent short walks each day. Be progressive with your activity. Increase the distance you are walking each time you are up. Deep breaths help to decrease the opportunity for pneumonia to develop. We recommend 10 deep breaths in as deeply as you can every hour while awake after surgery. Deep breaths help to break up any accumulated secretions, making it easier to cough them out. Inpatients will be given an incentive spirometer to assist with their deep breaths. An incentive spirometer is a measuring device. Bigger is better when it comes to deep breaths after surgery. You will not be allowed to have anything to eat after midnight the night before surgery. Clear, plain water is permitted until 2 hours before you arrive at the hospital the morning of surgery. The more empty your stomach is the morning of surgery, the safer it is for your lungs. Secondly, what can increase your risk of developing an infection after surgery? Being diabetic, smoking, poor hygiene, and having a preoperative infection on the day of surgery, as indicated by fever, sore throat, or some type of wound on the skin, can increase your infection risk. Longer hospital stays have been associated with a higher likelihood of developing an infection, and not following your surgeon's wound care instructions. How can you protect yourself from infection after surgery? Keep your glucose in good control if you are diabetic. A1C of less than 8.5 is required to proceed with surgery. Stop use of nicotine-containing products. Complete the recommended skin prep the evening before surgery. Remember, you must be free from any sign of infection the morning of surgery. If you feel yourself getting sick the week before surgery or have open wounds, call the office so we can reschedule your surgery for when you are healthy. Pursue your goal of early activity and walking to be stronger and more steady on your feet so you can be discharged as soon as it's appropriate. Follow your wound care instructions. They are specific to your surgeon's preferences. Patients and caregivers should wash their hands frequently with soap and water. Have fresh linen placed on your bed. Do not allow pets to sleep with you for the first several weeks after surgery. Finally, blood clots. Trauma and inactivity are the primary causes of blood clots. The trauma of surgery increases the clotting activity within our bloodstream. Clotting does not return to textbook normal for 6 weeks after surgery. Inactivity allows your circulation to become slower than usual, making it easier for clots to form. When clots form, they usually initially develop in our calves due to sluggish circulation. Blood clots can lead to stroke, heart attack, or pulmonary embolism. Some other risk factors that can increase your likelihood of developing a blood clot include obesity, varicose veins, medications that contain estrogen, being over the age of 40, and smoking. The more of these risk factors that apply to you, the higher your risk of developing a blood clot after surgery. What can you do to protect yourself from blood clots? Early activity or walking. Remember to get up and moving as soon as you're allowed to after surgery, and increase the distance you walk each time you are up. You will also be given sequential compression devices, or SCDs. SCDs are sleeves that fit over your lower legs and massage your calves to improve circulation. The more time you spend wearing the SCDs while in bed, the more protection you receive. Ankle pumps are another activity that can improve your circulation as well. Ankle pumps are nothing more than flexing your foot at the ankle up toward your head as hard as you can, alternating with pressing your foot down toward the floor. This activity fires your calf muscle and improves circulation. We recommend 10 vigorous ankle pumps every hour after surgery while awake. Medications. Dr. Fetty will review your medication list and give you written instructions regarding your medications. It is imperative to stop some medications prior to surgery, such as blood thinners, steroids, and anti-inflammatory medications. If you are taking any of these medications, she will tell you what day to stop them. Dr. Fetty will also instruct you which of your routine medications you should take the morning of surgery before coming to the hospital. Arrival time on the day of surgery. Your surgeon's office will call you the last business day prior to your surgery with your arrival time. Calls are usually made between 1 and 4 p.m. If you do not answer but have voicemail, we will leave a message with your arrival time. If you do not receive a call prior to 4 p.m., call the office at 304-691-1787 for Drs. Kahn, Fan, and Pinker-Dover. Dr. Kim's patients will call 304-691-1262. In order to decrease the opportunity for infection and prepare your skin, you are to complete a special skin prep the evening before surgery. First, shower with an antibacterial soap and wash your hair with your regular shampoo. Rinse thoroughly and towel dry as you normally would with a clean, dry towel. Once you are completely dry, you will complete the chlorhexidine gluconate, or CHG, skin prep as instructed by pre-admission testing with the kit provided. Using all 6 wipes, wipe down all of your skin surface starting at your chin and working to the soles of your feet in the front, then start at your hairline and work to the soles of your feet in the back. Someone will likely need to help you with your back. Make certain to cover all of your skin surface as described. Avoid eyes, ears, nose, mouth, and your immediate genitalia. CHG is not approved for use in mucous membranes. Allow the CHG to air dry on your skin surface. When your skin no longer feels tacky to touch, you can get dressed and go on about your evening. CHG will continue to work to kill the bacteria on your skin surface for the next several hours after it's applied. Remember, nothing to eat after midnight the night before surgery. No gum, candy, mints, tobacco products, or smokeless tobacco. You may have water until 2 hours before arrival at the hospital the day of surgery. The morning of surgery, do not shower. Remove fingernail and toenail polish, remove jewelry, and do not wear makeup. What to bring to the hospital. Plan to pack a bag even if you are not planning to spend the night. Sometimes plans change. Bring your usual toiletries, toothbrush, toothpaste, etc. If you have sleep apnea, bring your CPAP mask and machine. Bring shoes with non-skid soles, not slip-ons or flip-flops. Tennis shoes are perfect. Bring loose-fitting, comfortable clothing. t-shirt, gym shorts, sweatpants, two-piece pajamas, anything that will help to protect your modesty while walking in the hallway with physical therapy. What to leave at home: large amounts of money, credit cards, medications, jewelry, and valuables. The morning of surgery, enter through the Marshall University Medical Center entrance. This is the entrance pictured, and it is the closest to the parking garage. You will be entering the facility on the ground floor. From the entrance, you will proceed to the west elevators. Take the west elevators to the second floor. When the elevator doors open on the second floor, you will be facing the surgery waiting area desk that you see pictured. Check in here. This is where your pre-op nurse will find you when it's your turn to get ready for your procedure. The surgery waiting area is where the surgeon will look for your family when surgery is over to give them an update on your procedure in progress. When it's your turn to get ready for surgery, your pre-op nurse will call you back to the pre-operative area. Here we will verify important information like name, date of birth, procedure, and contact person's information. Next, you will complete a second CHG skin prep and change into your hospital gown. You will meet your anesthesia staff, have your IV started, and meet your surgery staff. Your surgeon will stop by to answer final questions and sign the consent. Then the surgeon will use a purple skin marker to mark the surgical site. This is a national safety standard. The preoperative area is also where we will apply your SCD sleeves for blood clot prevention. Once all of these steps are completed and all questions are answered, anesthesia and the patient will proceed to the operating room. The OR will look like the one seen here. After you are asleep, your airway is secure. A catheter, which is a thin tube, may be placed in your bladder to drain urine. Surgical procedures vary in length. Surgery staff will update your family member of progress while you are in surgery. At the end of surgery, a drain may be placed in your surgical site to drain fluid from the incision. The surgeon will speak with a family member after surgery is completed. The patient and anesthesia will proceed to the post-anesthesia care unit or PACU. Your stay in the PACU is usually 1 to 4 hours, but could be longer. You will have all of the same monitors that you had in the operating room. As you begin to wake up in the PACU, your nurse will remind you to do your deep breaths and ankle pumps. You will be permitted to have ice chips as tolerated. You will have pain medication ordered before you leave the operating room. Pain medication is ordered on an as-needed basis. The nurses will ask you to rate your pain intensity. We use the 0 to 10 scale, 0 being no pain and 10 being the worst imaginable pain. Our goal is 4 to 6 or less. Being pain-free the first few days after surgery is unrealistic. Once you are awake, stable, and have adequate pain control, you will be transferred to the 2 north bed towers, which is the spine unit, or to the outpatient surgery unit if you are not spending the night. Narcotic pain medication is the gold standard for pain control after spine surgery. Unless previously discussed, we typically use morphine IV through the night, the first night after surgery. Depending on what surgery you've had done, we will likely transition to oral pain medication the first morning after surgery. We use Norco or Percocet. Some patients may also receive a muscle relaxer. We encourage patients to maintain their pain level around 4 to 6 on the 0 to 10 scale. 4 to 6 says, yes, I have some discomfort, but it's tolerable. You are encouraged to ask for your pain medication and keep your pain at a tolerable level. We have a good feel for what type and how much pain medication is required for each procedure. However, patients metabolize medication differently. If your pain regimen isn't getting your pain to the tolerable level, let your physicians or nurse practitioner know so the adjustments can be made. Expecting a pain level of 0 or 1 the first few days after surgery is unrealistic. You have the option of a non-opioid pain medication regimen if you would prefer not to receive narcotic or opioid pain medication. This alternative includes Tylenol, anti-inflammatory medication, muscle relaxers, cool or warm compresses, repositioning, and distraction techniques. If you would prefer this option, please discuss it with your surgeon prior to the day of surgery. We will follow the narcotic regimen unless the non-opioid alternative has been previously requested and agreed upon by the patient and the surgeon. Patients who are in the hospital, have received anesthesia and pain medication, are at increased risk for falls. For this reason, we ask that you have someone accompany you when getting out of bed, especially for the first time after surgery. Remember, call, don't fall. When getting out of bed, change positions slowly. Sit on the side of the bed for a few minutes before standing to walk. Wear shoes with non-skid soles and use assistive devices such as a walker or cane if recommended by physical therapy. What can you expect after surgery? Most patients are on a regular diet at this point. You may have a drain to collect fluid from your wound. Drain removal is dependent upon the amount of drainage the wound produces. You may have a catheter to drain urine from your bladder. If you have a catheter, it will likely be removed early in the morning the first day after surgery. Your first priority is to get out of bed and get moving unless otherwise instructed. The longer you remain in bed, the more stiff and sore you become, and the more painful and difficult it is to get out of bed. Remember to ask for assistance to get out of bed the first time. A good start is to sit in a chair at bedside. You are encouraged to walk approximately 10 meters or 32 feet on the day of surgery with assistance. Be progressive with your activity. If you are an SI joint fusion, you will be given a walker. Do not ambulate without your walker. Maintain good pain control makes activity more tolerable. Continue using the incentive spirometer and deep breaths, and wear your sequential compression devices and doing your ankle pumps to help protect you from complications. Goals for the day of surgery are progressive activity. Sit up in the chair at bedside, walk 10 meters with assistance if needed, and good pain control. A goal of less than or equal to 4 to 6 out of 10. What can you expect the first day after surgery? In most cases, if you had a catheter placed, it will be removed early in the morning. If you have a wound drain, it may be removed later in the day. Drain removal is dependent on the amount of drainage the wound produces. Be progressive with your activity. Up to chair at bedside for meals, and walk 30 meters or approximately 98 feet with assistance if necessary. Maintaining good pain control makes activity more tolerable. Continue using the incentive spirometer or deep breaths and SCDs and ankle pumps to help protect you from complications. Physical therapy and occupational therapy are usually in between breakfast and lunch to complete an evaluation of your strengths, weaknesses, balance, and rehabilitation needs. They will assess for needs such as a walker or an acute rehabilitation facility upon discharge. A social worker will see you to discuss post-discharge needs and options and to begin discharge planning. If any equipment or a stay in a rehabilitation facility is needed, the social work team will be available to arrange equipment delivery and facilitate your transition to the next facility. Remember, the goals for post-operative day 1 and 2 are catheter and drain removed, progressive activity, walking 30 to 80 meters with physical therapy, and pain control less than or equal to 4 to 6 out of 10.
The following is a list of a few specifics for individual procedures. If you have had surgery on your neck, if you have been given a cervical collar, wear it as instructed by your surgeon. It should be worn when you are up and about during the day. You may remove the collar for hygiene. The soft material of the collar can be hand washed if needed in baby shampoo and water. Rinse thoroughly and air dry. Inspect the skin under the collar daily for signs of irritation or redness, for breakdown or pressure. If noted, contact your surgeon's office. Do not sleep sitting up. You may have the head of the bed or the recliner elevated slightly.
Some neck surgery patients experience muscle spasms across the back of the shoulders after surgery. Doing these exercises can help to break the cycle of muscle spasms. Relax your shoulders down away from your ears. Squeeze your shoulder blades together in the center of your back and hold for 30 seconds. Relax and repeat the sequence. You may need to repeat the sequence several times, but it will interrupt the cycle of muscle spasms. If you have had a low back spinal fusion, if a back brace is required after surgery, it will be delivered to your room by physical therapy on the first day after surgery. PT will teach you how to apply and remove the brace. Wear the brace when you are out of bed until the surgeon tells you to stop, usually 12 weeks. The soft material of the brace can be hand washed if needed in baby shampoo and water, rinsed thoroughly and allowed to air dry. Inspect the skin under your brace daily for signs of irritation or redness, breakdown, or pressure. If noted, contact your surgeon's office. Avoid anti-inflammatory medications for 6 weeks after surgery unless otherwise instructed by your surgeon. What are the goals for discharge home from the hospital? You should be able to perform your activities of daily living with minimal or no assistance. Have an acceptable oral intake, keeping food and fluids down. Able to urinate without difficulty. Have a pain level of less than or equal to 4 to 6 out of 10 with oral pain medication. Discharges usually occur between noon and 4 p.m. Plan for transportation home from the hospital the day of surgery. Patients are not permitted to drive themselves home when discharged. When you are ready to be discharged from the hospital, you will be transitioned home to an acute rehabilitation facility or to a skilled nursing facility, depending on your needs. This begins the recovery phase. It is imperative that you follow your surgeon's instructions for the care of your incision. You will be given specific verbal and written instructions on the day of discharge. You will have multiple layers of absorbable stitches on the inside. Your skin surface will either have dermabond or skin glue, steri strips, skin staples, or sutures, depending on your surgeon's preference. If you have a dressing over your incision, you will be given instructions on when to remove the dressing. You will also be given instructions on when you may begin to shower. For Dr. Fan, dermabond will be removed at 2 weeks post-op visit, or it may fall off by itself. Shower daily, starting on post-operative day 2. If you have Primapore, Aquacel, or a Pico or Pravina dressing, may be removed after 7 days post-operative, unless instructed otherwise. Shower daily, starting the day the dressing is removed. Do not submerge the incision for 6 to 8 weeks. Dr. Khan, dermabond will fall off on its own. If you have Primapore, Aquacel, or Acticoat, it may be removed on post-operative day 2. Shower daily, starting 72 hours after surgery. Do not submerge your incision for 6 weeks. For Dr. Kim, you may shower on post-operative day 3. No tub baths or swimming pools. for 6 to 8 weeks post-operatively. Keep the incision clean and dry. No ointments or creams. If you are an anterior neck surgery or an ACDF, remove the Primapore dressing on post-operative day 3 and shower. Leave the steri strips intact until they fall off, or they will be removed at the office. If you are a posterior neck surgery, remove the Primapore dressing on post-operative day 3 and shower. Leave the Dermabond tape intact until follow-up. You may recover your incision with gauze and paper tape. For smaller lumbar surgeries, remove the Primapore dressing on post-operative day number 3. Leave the steri strips intact until follow-up. You may recover your incision with gauze and paper tape. For larger lumbar surgeries or fusions, remove the Primapore dressing on post-operative day 3 and shower. Leave the Dermabond tape intact until follow-up. You may recover your incision with gauze and paper tape. For Dr. Pinker-Dover, remove the dressing on post-operative day 2 if one was applied and shower daily, starting at 48 hours after surgery. Do not scrub your incision. Allow soapy water to roll over the incision. Rinse with running water and pat dry. Leave the incision open to air. Do not submerge your incision for 6 weeks. Call the office with any sign of redness or drainage from your incision. General activity instructions after discharge. Follow your surgeon's instructions regarding showering. No repetitive bending or twisting. No lifting greater than 5 to 10 pounds. No overhead lifting. No pushing or pulling. No driving for 2 weeks, longer if you are taking prescription pain medication. You may receive a survey after you are discharged asking about your care. It may be by phone, standard mail, or email depending on the information you provided. Your responses are important and impact how we provide care. If you receive a survey, please complete it. Follow-up appointments. You will see your surgeon in the office 1 to 2 weeks after surgery. The appointment date and time will be written down in the instructions provided at discharge from the hospital. What should I watch for after I go home? Call the surgeon's office if you notice any of the symptoms, as they may be a sign of infection. Fever over 101, redness around the incision, pink is normal. Drainage from the incision, especially if the drainage is yellow, green, or has a foul odor. Infections are rare, however, when they occur, the sooner we act on them, the better the outcome. If you have a problem or a question after you are discharged from the hospital, call the office at 304-691-1787 if you are a patient of Dr. Kahn, Dr. Fan, or Dr. Pinker-Dover. If you are a patient of Dr. Kim, call his office at 304-691-1262. During regular business hours, you will be transferred to your surgeon's nurse. After hours, these same numbers are answered by our answering service, who can put you in contact with the surgeon on call. The surgeon on call can advise you on how to proceed. The surgeon is on call 24 hours a day, 7 days a week for emergencies. Please read over the written information provided. Read your booklet, A Guide to Understanding Your Cervical Surgery or A Guide to Understanding Your Thoracic or Lumbar Surgery. Read your discharge instruction sheet and read the leaflet, Impact of Tobacco on Spinal Surgery. Also read the information you were provided on nutrition tips for surgery. After watching the video, you must call the Back and Spine Program office to complete the required post-test and Oswestry Disability Index over the phone. We can also discuss any additional questions you may have. This must be completed prior to the day of surgery. We can be reached at 304-526-2613, Monday through Friday, 7 a.m. to 3 p.m. Thank you for allowing the Back and Spine Center at Cabell Huntington Hospital and Marshall Health Network the opportunity to care for you.